Good day and welcome to 0 to 3 Setting the Stage Active Implementation Frameworks to Integrate the Science and Practice of Implementation webinar. Today's conference is being recorded. At this time, I'd like to turn the conference over to Kelly Clare. Please go ahead.
Hello everyone, my name is Kelly Clare. I'm with iLink and I will be available today for any technical questions you may have during the webinar. A couple of housekeeping items. There is a hand raise status at the top. We will not be using that for today's conference. We will tell you in a minute how to get your questions over to the leaders of the session today. So please utilize that. At this time, I would like to turn it over to Maria. Maria, if you'd like to go ahead.
Thank you, Kelly. And thank you all for joining us today for Setting the Stage Active Implementation Frameworks to Integrate the Science and Practice of Implementation. Today we will hear from three presenters. The first, Nancy Gagliano, is the Director of Home Visiting at Thrive by 5 Washington. Nancy's expertise focuses on implementation, capacity building, and ongoing evaluation for continuous quality improvement of evidence-based home visiting programs. Prior to this position, Nancy was the Director of Programs and Evaluation for the Council for Children and Families, overseeing the EBHV portfolio in Washington. Nancy has presented at several national conferences and events on evidence-based home visiting implementation. Our second speaker, Allison Metz, is a developmental psychologist, Associate Director of the National Implementation Research Network, and scientist at the Frank Porter Graham Child Development Institute at the University of North Carolina at Chapel Hill. Dr. Metz specializes in the effective implementation and scaling up of evidence-based and evidence-informed programs and strategies in early childhood, early care and education, and child welfare settings. She has expertise in the areas of organizational and systems change, implementation science, capacity building, training and technical assistance, and coaching. Finally, we will hear from Laura Lewison, the North Carolina Maternal, Infant, and Early Childhood Home Visiting Program Director with the North Carolina Division of Public Health. Ms. Lewison is responsible for the implementation of the McVie Home Visiting Program. Additionally, she works with public and private stakeholders in guiding the implementation of Nurse-Family Partnership in North Carolina. Prior to this position, she provided quality improvement coaching to mental health organizations and coordinated a resource and referral project focused on perinatal substance abuse. And I will be your fearless facilitator today, and I am Maria Gale, a Technical Assistance Specialist from the Maternal, Infant, and Early Childhood Home Visiting Technical Assistance Coordinating Center, which is a mouthful, so we prefer to call it the TAC, and we are hosting this webinar today. As many of you know, the TAC is quite new and funded by HRSA. TAC operates from 0 to 3 and in partnership with Chapin Hall, AMCHIP, and WRMA. We're funded by HRSA to provide many levels of TA support to McVie grantees, including webinars like this. And very soon you'll be receiving a save the date with information about additional webinars planned for this fiscal year. Before we get started on the presentations today, I'd like to do a little housekeeping. I want to let you all know that you will be muted for the duration of the call. However, you're welcome to chat any questions you have at any time during the webinar. You may also wait to chat your questions at the end of the presentation during the question and answer time. Today we're going to do our best to answer all of your content-related questions during Q&A. And now I want to thank you all for being here and turn it over to Monique, who will provide a welcome on behalf of HRSA. Monique?
Good afternoon to some and good morning to others. Thank you for joining us for today's presentation on Setting the Stage, Active Implementation Frameworks to Integrate the Science and Practice of Implementation. My name is Monique Fountain-Hanna. I'm the Regional Project Officer for the Region 3 McVie and Early Childhood Comprehensive System Grants. On behalf of my HRSA colleagues in the 9 other HRSA regional offices, as well as our HRSA Central Office staff, it is my pleasure to welcome all of our states, territories, and our various partners to today's discussion on implementation science. As I was reflecting on today's discussion topic, and specifically on the title of Setting the Stage, I was reminded of a well-known quote from William Shakespeare, which states that all the world's a stage, and all the men and women merely players. They have their exits and their entrances, and one man in his time plays many parts, his acts being 7 ages. At first, the infant mewling and puking in the nurse's arms. As you might surmise by my picture on the screen, I'm all too familiar with the first stage as Shakespeare so eloquently describes it as the first of seven stages of life, and that being the one of an infant mewling and puking in the nurse's arms. On the screen is a picture of my daughter, Janelle, who just turned 4 months old and unfortunately suffers from gastric reflux. So not only does she mule, but she definitely pukes, and she does so quite frequently. Today, you'll have the opportunity to hear from presenters about the science and actual practice of home visiting implementation and the necessary building blocks to ensure that your home visiting programs are producing the sort of outcomes that the evidence-based models that you've chosen to implement are designed to produce. I hope that you'll keep in mind the imagery that Shakespeare painted of the crying, puking child, but that you envision that child in the arms of a skilled, loving, empathic, culturally competent home visitor who's implementing the chosen model with fidelity. Again, thank you, and on behalf of your HRSA team, welcome. Maria, I'll turn it back over to you.
Thank you, Monique, and thank you for that lovely reminder of why we're all here today, and what a beautiful reminder on the screen also. Right now I'm going to quickly go over the learning objectives for today. What you'll be listening to is going to help you identify implementation prerequisites, examine key activities in each of the stages of the implementation process, describe critical components of the implementation infrastructure, and we're also going to explore effective methods to problem solve and improve processes and practices, identify structures and functions needed to support wide-scale use of effective practices. We're also going to discuss 2 states approaches to utilizing the implementation science framework, including getting started and lessons learned. So today we're going to tell you a story, and actually it's a story you all know and have been living over this past year. Just about this time last year, you were all more or less in Kansas. A few of you were literally in Kansas, but all of you were focused on home visiting activities in your state and excited about the upcoming opportunities for expansion. And then the tornado hit. The SIR, quickly followed by the competitive grant application, then the fiscal year 11 application, and then a focus on the benchmark plans. It's really been quite a tornado. Right now, I suspect some of you are still feeling a little like you're in the tornado, and maybe some of you are feeling like you've recently landed in an unfamiliar place. Our presenters today are going to tell you about their journeys through the tornado and towards quality implementation. Our first presenter, Nancy Gagliano, is going to tell us about getting started. Then Allison Metz from NERN is going to describe some frameworks and tools that can help you ensure quality and protection from the poppy fields, the flying monkeys, and even the Wicked Witch. And our last presenter, Laura Lewison, is going to share how North Carolina has begun to travel the yellow brick road. So now I will turn it over to a woman with a fantastic pair of ruby slippers, Nancy.
Thanks, Maria. Did you say ruby slippers? Thanks for remembering my affinity for a great pair of shoes. Hello everyone. My name is Nancy Gagliano, and I'm the Director of Home Visiting at Thrive by 5 Washington. I want to tell you a story first, and it's a real-life story on how the world of science and practice collided here in Washington. Once upon a time, there was a girl minding her own business implementing a community-based prevention program in Washington State. This prevention program was awarded one of 5 grants in Washington with community-based child abuse prevention funding, and many of you know that that's the CBCAP funding. The lead organization for CBCAP dollars in Washington is the Council for Children and Families, or CCF. And what CCF does with the CBCAP dollars is award grants for 2 community-based programs, and these grants are for 3 years. But what's interesting about the CCF CBCAP funding is CCF doesn't just give programs the money. No, not that simple. There are all these crazy things that programs have to do under the heading of continuous quality improvement or building capacity for quality program development. Now, the reality was the people running this prevention program in Washington that was awarded the CCF funding had no idea what CQI was, what building capacity for program development was. They were just thrilled they got the funding. So they got the award, signed the grant agreement, and the girl attended the CCF orientation. She was given a big notebook at the orientation with tabs and tabs of all the things the program she was running had to do over the 3 years to be successful, or in reality, to keep the funding. And the nice CCF staff went over each tab at the orientation. And the tab said things like creating a logic model, quarterly reporting, site visits, written year-end reporting requirements, and the feedback and coaching that would be provided each step of the way by the CCF staff and consultants to move that program forward. And in reality, what the girl remembered most from the full day of orientation was the lunch and the afternoon snacks. The girl left the orientation with the heavy notebook in her hand and promptly placed it on her office bookshelf. As the days passed after the orientation, the girl and her team kept doing what they were doing before they got the grant award. They were serving families. When the first quarter came to an end, the girl wrote the first quarterly report, emailed it to CCF, and forgot about it. After about a week, the girl got a phone call from the director at CCF. The CCF director asked, actually they kind of demanded, that the girl and her boss come to the CCF office in Seattle that same week. There were concerns about what the program said they were going to do on the application and what they were actually doing. The girl hung up the phone and burst into tears. The details about the specifics of what wasn't happening are not so important for this story. The reality was the prevention program the girl was running was supposed to serve a certain number of families in year one, and they were nowhere near that goal by the end of the first quarter. At the mandatory meeting, the CCF director asked the girl and her boss to develop a 3-month outreach corrective action strategy to get more families to engage in the services. The girl was to have weekly check-ins with the CCF director to let him know how they were doing on their recruitment, and would have the opportunity to brainstorm and make adjustments to their strategy to keep things moving along. And then came the zinger. If there wasn't an improvement by the next quarter report, well then the CCF director said the prevention program may not be the right match for the funding. All the girl remembers from that meeting was that the director of CCF was dead serious and at the same time very kind. She grew up that day. So let me fast forward to 8 years later in this story. That prevention program that the girl was managing is up and running and serving over 500 parents a year. In no scientific terms, what that girl and her team and that boss and that agency learned was, to get great, there had to be a plan for what you were going to do, action taken to put that plan in motion, someone that takes a real interest in what you're doing, checks in regularly, brainstorms about course corrections frequently, and adjustments have to be made. Oh, and it helps if this someone has some connection to the dollars. So this program in Washington ultimately helped more and more families for sure. But the way they got to the end point was by building their own internal capacity and implementation. But no one was calling it that back then. Oh, and that girl, by the way, if you haven't figured this out yet, became the director of Programs and Evaluation for CCF and is now the Director of Home Visiting at Thrive, and that girl is me. I wanted to tell you this story because implementation is such a process, and that it is a process of learning course correction, and it takes time. Next slide. Okay, so now let's get back to the bigger ruby slippers of Washington State home visiting. And as you can see from this slide, and I'm sure in your state as well, is communities in Washington have been delivering evidence-based, research-based, and promising home visiting services to families for many, many years. And from the slide, you can see that there are multiple funders supporting this work. So like I mentioned, the Council for Children and Families, 5x5 Washington, United Way, federal funding streams. But what I'm really going to talk to you about is the Home Visiting Services account. It's one of the funding mechanisms. Next slide. Okay, you're on the right slide, thanks. In 2010, Washington State and the private sector started investing together. There was the creation of the Home Visiting Services account. The revenues in the HVSA consist of appropriations by the legislature and all other private and public sources deposited into the account. So the HVSA is a funding mechanism. Washington State Department of Early Learning, DEL, contracts with the non-governmental private-public partnership, Thrive by 5 Washington, to administer programs funded through the HVSA. So what's important to note is that the HVSA requires that we expend funds from this matching account to fund home visiting services, but also to develop, administer, and maintain the infrastructure for training, evaluation, and quality improvement to support these home visiting programs. So as you can see, there's been the development at the policy level for quality implementation here in Washington. Next slide. Okay, so I'm going to tell you a little bit more about Thrive's role in the HVSA. So Thrive by 5 Washington raises the private match for the Home Visiting Services account. So we do fund development, we administer the grants awarded, and Thrive by 5 Washington is also the implementation hub for the HVSA grantees. And really, the implementation hub is a way to centralize the technical assistance for quality implementation. And so who makes up that implementation hub team? We have 2 staff here at Thrive. We have model consultation, state leads for the models that we're supporting. We have implementation specialist consultants, and as well as a rural specialist consultant. Next slide, please. And like the initial story, although on a much larger scale, getting the HVSA home visiting programs up and running and producing the promised model outcomes has presented multiple challenges. And like the slide shows, this feels more like walking on hot stones than fancy ruby slippers. There are definitely implementation challenges at the program level. There are also implementation challenges managing expectations of funders. And finally, there are sustainability challenges. So just in terms of at the program level, I'm sure you're all aware of these as well. Programs' understanding of fidelity to the model has been a challenge, as well as a program's ability to implement with fidelity, data management challenges, etc. I think in terms of the funders, we can all understand that all funders want results and they wanted them yesterday. So setting and maintaining realistic expectations is also a challenge, and certainly how do we tell this complex, messy work in progress story of building out home visiting? And finally, there are sustainability challenges. We all know about the recession and certainly the challenge of not having a permanent funding stream, so the ramping up and ramping down of dollars. So as you can see, the challenges in the HVSA implementation are some very complex details to manage. Next slide. So I really like this slide. So implementing evidence-based home visiting programs is not just buying the evidence-based model, getting some training, delivering services, and presto, all the outcomes are achieved as promised. Next slide. So I'm going to just briefly share some wisdom that we've learned along the way and what we have done. The first thing we had to do in trying to understand all these challenges was we had to assess the situation before we could understand where help was needed. And we did this in two ways. For each, one was around logic models and the other is around capacity assessments. So for each and every HVSA grantee, we worked with the program to create real program logic models. That is, not taking the evidence-based home visiting logic model and assuming that programs were actually following that to a T. But we worked with each program and have developed and have the programs tell their story of what they're actually doing. So the logic model was a tool to be used to discover what was actually in place in different communities. The second thing we did, we engaged in capacity assessments for each and every program to implement with fidelity. And we used the Friends discussion tool to assess each program's understanding of some key indicators for implementing with fidelity. So again, we did not assume that it was a given that programs were able to follow the science from the evidence-based model. We intentionally set out on understanding how each program was prepared to implement with fidelity through an assessment process. Next slide. Okay, 1 second. I'm a little bit lost in my slides. 1 second, sorry. Okay, at the same time, we also have engaged in an evaluation relationship with Washington State University Area Health Education Center. And WSU has been conducting a participatory evaluation of the HVSA portfolio. And what's funny is the lead evaluator, Chris Blodgett, kept raising this question to our team over the years. Have you read the implementation research, a synthesis of the literature out of the University of Florida? Next slide. And it's not that we ignored the question from Chris, but we were so busy assessing and acquiring information, and really the reality was what we were struggling with was, what do we do first? There were so many different needs at the program, the model, and the systems level. Next slide. And we kept hearing that same question from Chris Blodgett. Did you read the implementation science synthesis? And I'm not kidding. He said this probably 1,000 times. And as the slide indicates, we put that off for some time, and we were really just reacting and scrambling. So in a second, you're going to see on your screen a question we would like you to answer. And our question for you is, have you read the implementation research, a synthesis of the literature? Please take a few seconds to indicate your correct response. And don't feel bad if you haven't. So Holly? Okay, so I'm seeing the results right now, and I'm seeing 21% have indeed read the research literature, and 59% haven't quite gotten to that yet. And I honestly have to tell you that it really came down to the next slide, please. We did finally read the literature, and it really, at that point, really opened our eyes to how we could possibly begin to organize all these different challenges. So, but it wasn't that long ago, so I want to admit that fully. And that's basically where we are right now. It's really begin to help us get organized. Maria? I'm going to hand it back over to Maria.
Thank you, Nancy. That's a great real-world example and reminder of the complexity of implementation, and also some great examples of why we need implementation frameworks. And now we'll hear someone who is going to speak more deeply about these frameworks. I'm going to turn it over to Allison Metz from NERN.
Hi, everybody. It's nice to be with you this afternoon. I was telling Nancy yesterday when I was hearing her talk about the story about being asked many times had she read the implementation research synthesis, that I too was asked that question several years ago as I was doing quite a bit of work around replicating evidence-based models. At the time it was in child welfare. And when I finally read the synthesis, it was so groundbreaking for me in being able to provide a framework for the kind of really, really challenging work that we're all doing in the field. And I liked it so much that I ended up going to work for the National Implementation Research Network a few years ago, who's responsible for writing that synthesis. So it definitely had a big part in my professional life as well. So I am today talking about the use of active implementation frameworks and how we can really use them to improve implementation so that we improve outcomes for children and families. I always like to start off with a quote, and I think this is a great quote for today's webinar. It is one thing to say with the prophet Amos, "Let justice roll down like mighty waters," and quite another to work out the irrigation system. When I think about this quote, I also think about Nancy's slide when she talked about how, it's not just about purchasing an evidence-based model, doing some training, and presto, we have some outcomes that are good. I think all of us in this work know that irrigation system is actually quite challenging at times. And so really for many of us, this challenge is experienced in the way that we hope to bridge the gap between our best understanding of what works and then getting those ideas out into practice settings so that we can improve outcomes for children and families. And so this idea around the research to practice gap, or sometimes referred to as the science to service gap, for us, it's really this idea that we need a delivery pathway between research and practice, and implementation is that delivery pathway. And implementation is defined as a specified set of activities designed to put into practice a program of known dimensions. I think that piece is really important to kind of take a moment to think about, because implementation science is something that's really part of our ongoing dialogue. But really, the science of implementation is in service to a very well-defined program. So whether you're working with an evidence-based model or adapting one, or something that's perhaps more in the promising practice category, it's very important that that intervention or approach is well-defined, that you clearly understand the core components of the program so that you can use the implementation strategies that I'm going to talk about in a few minutes. And so we think, why do we focus on implementation? And we say it's because children and families cannot benefit from interventions they do not experience. And while that kind of seems like a duh statement, it's actually a really powerful one, because many times, that translation of research to practice is hard. And so if we don't focus on implementation, children and families aren't getting those interventions. Or many times when we try to implement, we have trouble doing so with good fidelity, and we have trouble sustaining interventions over time, especially with fidelity, to continue to get those good outcomes. And so we don't have children and families experiencing the intervention in the highest quality way, so that they're really not achieving the best outcomes that they could achieve. And so it's really important to think about implementation as that missing link between research and practice that allows us to achieve those outcomes. This next slide really, and I'm sorry about the lack of animation here on this slide, the quote would have kind of slid in a bit later, but really what this is talking about is that it's really only the combination of effective interventions and effective implementation strategies where we'll achieve those actual benefits to children and families. And this quote's very powerful, and it's actually from the juvenile justice field, but very applicable to all the work that we do in different areas of human services and education. Researcher Mark Lipsey had done a meta-analysis a few years ago, which basically means he just looked across a wide range of juvenile offender interventions that have found to be effective. And what he found was that in some analyses, the quality with which the intervention is implemented has been as strongly related to recidivism effects as the type of program. So much so that a well-implemented intervention of an inherently less efficacious type can outperform a more efficacious intervention that is poorly implemented. And so what that means is that you can have an intervention that is inherently better than another intervention, but the intervention that's implemented the best can really outperform an intervention that might even be at face value the better intervention. And so we're not here saying, like, let's implement less efficacious interventions, of course, but really it shows how powerful implementation is in the concept of high fidelity, because if you can have interventions that aren't even as good, but they're outperforming ones that are better because they're implemented well, it does show you how critical good implementation is. And also when I read that quote, what I think about is, wow, how powerful outcomes can be if we have not only the most efficacious intervention, but the best implementation of that efficacious intervention. That's where we really start to see socially meaningful impacts for children and families. And so when I read that quote, that's kind of where I go, and I think it reminds me how important it is that we really focus on high quality implementation. So Nancy had mentioned this implementation research, a synthesis of the literature, and it looked as if about maybe a quarter of you have reviewed this before. I just put the slide up there to show where some of this information is coming from. At the time, the synthesis was based on several things, one of which was a review of the literature of actually 750 journal articles where implementation was tested in some way. It was across a wide range of fields, including education and mental health, child welfare, even cancer prevention and other areas. And what we found was from that research that successful implementation on a useful scale really requires the active use of 4 frameworks. The first is the use of implementation core components or best practices of implementation, which we call implementation drivers. The next is the purposeful matching of critical implementation activities to the stage of the process. The next is the use of expert implementation support. I'll talk about that in terms of implementation teams, but there's other ways that you can achieve that kind of support. And then a focus on continuous and purposeful improvement. So in the next slides, I'll talk about each of these frameworks briefly. And since we've done that synthesis several years ago, we've actually looked at this point, I think it's about 2,600 journal articles, and continue to kind of code them to see if we can affirm our findings. And indeed, we have been able to, and been using these frameworks out in the field for several years, and I think are continuing to learn even more about how to apply them and how to really get that high quality implementation. Let's first talk about implementation drivers. These are defined as the common features of successful supports to help make full and effective use of a wide variety of innovations. So this really has to do with what were those supports that seemed to be in place when we looked across the literature and we saw interventions that were implemented well and had good effect, and they were replicated. What did we see that seemed to be common across them, regardless of the intervention itself or the curriculum that was being implemented? What from an implementation lens seemed to be the important things that were kind of holding the infrastructure in place and allowing that intervention to thrive in whatever system it was being placed into? And for us, it originally fell into 2 categories. Across the left side of the triangle, you see competency drivers. Along the right side of the triangle, you see organization drivers. At the base of the triangle is leadership strategies. That actually is not part of the initial synthesis. It's some work that we've added later, and it's based on the work of Ron Heifetz and the Cambridge Leadership Institute. I'm not going to talk really too much about that today. I'm going to focus on and the right side of the triangle. So on the left side, the competency drivers are related to how it is we develop, improve, and sustain our ability to implement a new intervention with good effect. So this is really at a practice level. How do we select staff, train them, coach them, and assess their performance? On the right side of the triangle, those drivers are related to how we create the hospitable organization and systems environments that really allow the intervention to thrive. And they include data systems, facilitative administration, which really just has to do with what kind of management procedures and policies are we putting in place at our agencies to ensure that practitioners can do their work and do it well. And systems interventions have to do with ensuring that we have the resources we need, financial, human, service resources, including external partnerships, to allow, again, the intervention to thrive in the current system. And so when we look across these drivers, what you're really seeing is the infrastructure that's needed to support effective implementation of home visiting approaches and improve outcomes for children and families. And we may look at these and think to ourselves, well, these are kind of common activities that everyone already conducts. So everyone selects staff and everyone trains staff, and most people do some sort of coaching or supervision with staff, and most people have data systems and management and policies and partnerships. And so what's so different about this? Well, when you think about this framework through an implementation lens, it actually takes on a bit of a different life form. And I'll give you some examples. So when we think about the selection of staff, for us, when we think about that through an implementation lens, we're really emphasizing the development of prerequisites that go beyond general educational and experience criteria and really help us describe what are the unteachables, what really represent the key staff characteristics that would allow them to implement a new service well. And so just to give an example, if you're implementing an approach that really involves good engagement strategies with families, perhaps an empowerment approach with families, these are some of the guiding principles. It might be challenging to hire someone that perhaps says, I can't wait to kind of roll up my sleeves and do this work and help to fix these families or help to fix this situation. And you might say to yourself, hey, that's a value system that might not mesh with our guiding principles to our intervention, and while we might be able to orient this person, it could take a long time, and it might be something we consider an unteachable or an untrainable. And so when we do selection work, we have best practices associated with that, where we do things like behavioral rehearsals, and we do very interactive interview processes. And I've worked with a lot of agencies that have installed those best practices around selection that really do not take that much additional resources or time to select that way. And folks really just say how much it changes the way that they hire staff and their kind of starting point for their intervention. If you look across on the right side of the triangle, just to give another example around how this might look different, you think of decision support data systems. And while many of us, or pretty much everyone who does this work has some sort of data system, it's thinking about how is it that we collect data at relevant and actionable levels and build it into practice routines and really institutionalize the approach of using data to drive decision-making and continuous improvement. That is very, very hard to do. For the most part, I think data is collected, but folks don't exactly know what to do with it. Or data is collected for compliance purposes or monitoring purposes rather than improvement purposes. When I was introduced, I said that I had done quite a bit of work in child welfare, and that's certainly a field as education and many other fields that I've worked in that's compliance driven. And so to kind of break that paradigm and to move into a new one where we're actually using data not kind of in fidelity in the concept of measuring performance assessment, not as really a gotcha moment, but is a how can we help do this better moment, is really a paradigm shift. And so those are just a couple examples of how when we use the best practices associated with each of these drivers, think about them through an implementation lens, they take on a whole new meaning, and they really create that infrastructure to effectively and sustainably implement new interventions over time. So this chart is one that it actually is an example. It comes from the field of education, but I thought it was just really applicable to the conversation today. It's looking across different districts across the country that were implementing a variety of comprehensive school reforms. And it started out with the good intention that every teacher would be trained and every teacher would be continually supported in the way that they do their work. Years 1 through 3 in the studies that were done, fewer than 50% of teachers actually received training, and fewer than 25% of those teachers received ongoing support. So they didn't really receive that mentoring and coaching that was so critical for them to translate what they learned in training and to generalize it to a real practice setting. So when you look at outcomes in years 4 to 5, fewer than 10% of the schools used the CSR, the comprehensive reform, as intended, and a vast majority of students did not benefit. I think this is a story that we know of a lot, and it goes back to that first quote, that children and families cannot benefit from services they do not experience. I think this really represents that we set out with those good intentions, and in the end, in this study, the vast majority of kids did not receive those reforms and did not benefit. When you think about the driver's triangle, you think to yourself, okay, there were some failings there, and you think, okay, so training on the competency side didn't happen or didn't happen effectively and it didn't reach all the teachers it should have. Kind of ongoing coaching in the field, moving up the triangle, didn't happen. And so, as you continue to move up the triangle, you could say to yourself, so it would make sense that we wouldn't really have fidelity to the model if the training and coaching, weren't put in place. But it's more than that. If you really think about the drivers in an integrated way, you look on the right side of the triangle and you think to yourself, well, what could have gone wrong on that side of the triangle in terms of why was training not provided to everyone in a timely way? Why was coaching not going on in a meaningful way for all of these teachers so that they could generalize these fragile skills into the classroom? Well, you could say to yourself, think about that facilitated administration driver that I said was really about management and policies and procedures and kind of processes that are put in place from administrators and leaders to ensure that practitioners can do their work. So were there some failings on that side of the triangle? So, was there not leave time set up so that teachers could actually go get the training that they needed? Was there not policies put in place that supported ongoing coaching? Or I might look at the systems intervention driver and say, was this an external resource issue or a partnership issue why these things didn't happen? Or I might come on the bottom of that right side of the triangle and say, how were we using data during those 5 years? When could we have figured out what could have been a critical decision point for us to see, hey, actually teachers aren't getting what they need and we don't have fidelity to these models and we're not getting good outcomes. So how was data driving continuous improvement during those 5 years? So I think it's a good example to show how the drivers are really quite integrated. So if you see that training's not happening, your mind kind of moves all around the triangle to kind of see what's not happening at a systems level to support that. So I'm going to, next what we're going to see in a moment on your screen, you're going to have a question that asks you, in your experience in implementing home visiting programs, have you paid more attention to certain implementation drivers than others? So, has it been that you focused more maybe on competency drivers or more on organizational drivers, or maybe you focused on many of them but have not focused enough on the data piece or things like that? I'd be curious to see your answer to this question, and if you would like to have a comment about it, feel free to put that comment in your public chat in the lower left of your corner and just to provide some context for your answers. Okay, so it looks in the results that more of you are saying that you have paid attention to certain drivers more than others. So it's looking like more of you are saying you definitely have not devoted an equal amount of time to all around that triangle. And That's an important thing, to think about. Some people are kind of writing in now in the public chat that they've paid more or less attention to certain drivers. Some examples to do with the data, decision-making driver, the training driver. And I think that this is a really good thought because it's that full infrastructure that really allows us to kind of contain and sustain that intervention so we can confidently use it over time. And so if we're kind of missing pieces on the triangle, that does cause some challenges for us. This quote says, all organizations and systems are designed intentionally or unwittingly to achieve precisely the results that they get. And really what this means is that we are set up to get the outcomes that we're currently achieving. And so it is this idea about, practice change cannot happen without accompanying systems change. So when we think about what it takes, we need to develop, improve, and maintain staff competency. Those are the competency drivers. Develop, improve, and sustain hospitable organization and systems environments, the organization drivers, and then use those appropriate leadership strategies, which we did not really talk too much about today. And really this is so important because when we think what typically happens when we start a new innovation, and when you're thinking about your evidence-based home visiting model, many times what happens is as that model enters your current system is pretty powerful. We kind of call that the status quo. Many times what we see happen is that system really pushes down on the new model, and at some point that model changes to accommodate the system. And you look over time and you look back and you say to yourself, boy, when we first conceived this 2 or 3 years ago, I didn't think it would turn out this way. And it's because your system really pushed down on the new innovation you were trying, and that new innovation ended up being modified to accommodate the system. But really what we want to happen is the other box, the one with the red writing, where it says that the existing system is changed to support the effectiveness of the innovation. So it's not that the innovation that has to change to accommodate the status quo, but the status quo is changed to accommodate the innovation. You're making those changes at organizational and systems levels to ensure that that new intervention that you're trying out has a fighting chance. So this is really about this kind of idea about the right side of the triangle really being in service to that left side of the triangle. The second framework, that we found in looking through the literature is that implementation really happens in discernible stages. Now, is it a completely linear process? Definitely not. So this graphic's a bit misguided in that sense, but it's the easiest way, I think, to present the information. Many times we move from one piece of an implementation stage and we have to move backwards at some point, or some of the stages are overlapping and we're kind of working between 2 stages at one time. But for sure, what we do know is that there are key activities and key components that need to happen during each stage of implementation, and that we don't really it's not really okay to skip any of these stages, should I say. So in exploration, that's really when we're assessing the needs of our target population. We're examining the fit and the feasibility of implementing certain program models in our community, involving stakeholders, operationalizing models more fully if we need to, and making a decision to move forward or not. Really the hallmark of exploration is making a decision about whether it's desirable and feasible to move forward. And really what I'm thinking about with the drivers during exploration is I'm thinking about what would it take to install all of them. So if I'm thinking about a certain model and I'm wondering how feasible it is for my community to implement that model, I'm thinking about selection, training, and coaching practices. I'm thinking about what data systems would need to look like. I'm thinking about what policies I might need to put in place. So I'm kind of moving up and down that triangle during exploration as part of my feasibility assessment. Installation, this is a stage of implementation that's often overlooked. Many times we do good exploration work and then jump right into delivering services. But installation is really that gap period between making a decision to move forward and actually serving families. And during this period, new services are not yet delivered, but you're developing the implementation supports and you're making those necessary structural and instrumental changes to move forward. So thinking about it, you're really installing the drivers right now. You're putting the training plan in place. You're getting your data system up and running. Initial implementation is when you actually initiate service delivery. You're doing rapid cycle problem solving by breaking that paradigm down and using data to drive decision making and not just for compliance purposes. And then over the course of 2 to 4 years, you finally move to full implementation where you have skillful, routinized practices. Your system and organizational changes are institutionalized, and it's really now that it would be appropriate to measure child and family level outcomes. So in a moment, you're going to have a question appear on the screen. We're just kind of curious, what stage do you feel that you're currently in when it comes to implementation? Exploration, installation, initial implementation, or full implementation? To get the results here in just a moment. So it sounds like a lot of you are kind of in that initial implementation stage, about a quarter of you, about another 18% or so are in installation. So many of you are in those kind of middle stages. So that's actually very interesting as we talk about this, and really a chance to think about your infrastructure and ways to strengthen that. We'll move back to the presentation. So in the final two frameworks, this is the third framework, is really about that organized expert support. And for the most part, we've worked in paradigms as well around letting it happen and helping it happen when it comes to translating research to practice. What that means is we just hope that people read information and can do something with it, or helping it happen might mean that we do have some training manuals or some other kind of tip sheets provided. But in both those cases, recipients of the information are accountable for actually putting things in practice. Where making it happen means that we're actively building those expert teams, the kind of supports that are necessary, building the capacity to have effective implementation in your community or county or state. And we call those implementation teams. They can be internal in your state. They can involve external consultants. You can have purveyors or program developers. So if you're working with evidence-based models, they typically come with program developers attached that can help do some of this work. So that's really the kind of making it happen strategy that we're really looking at implementation teams. And again, they can look a little bit different. But what they really do is they provide an accountable structure to move through the stages of implementation. The scope of your initiative really determines what your teaming structure looks like. So it can look pretty different in different states I've worked in. Those teaming structures in terms of membership and roles and how many teams there are look different. But the focus is really on buy-in and readiness, installing and sustaining the drivers. So these are groups of folks that are fluent and understand the concept of implementation science and the infrastructure needed to do the work, and they're really monitoring whether or not all those pieces to the puzzle are in place. They're thinking about fidelity and looking at whether that's correlated with outcomes. They're doing that good stage-based work, looking at systems alignment and problem solving. The last framework is on improvement cycles. And this slide really talks about how new practices do not fare well in existing organizational structures and systems, kind of going back to that idea that we're talking about, that many times the innovation is changed based on the system rather than the opposite happening. And really what we know is that people, organization, and systems cannot change everything at once. We can't stop and retool. We need to keep serving families even as we're trying out new things. And many times outcomes are predictable and we don't know what to do at every step of the way, which is why it's so important that we have as part of our culture a learning culture and learning communities where we're incorporating very traditional PDSA cycles, which I'm sure many of you are familiar with. The idea that we plan, we decide what we want to do, we do it, we study, and we look at the results of what we're doing, either at a process level or an outcome level, and then we act. We make adjustments based on those results to improve how we're doing things, and then we do that cycle over and over again. And one of the many, many different kinds of PDSA cycles, I mentioned rapid cycle problem solving, things like that are considered PDSA cycles. And your implementation teams are really actively doing those PDSA cycles when they get together. But kind of a larger PDSA cycle I just wanted to bring to our attention is this idea of policy practice feedback loops. Because I think we're really good at one part of this feedback loop, which is that good policy enables good practice. But really, there's many times barriers experienced to implementation that happen at a practice level that can really only be solved at a higher level of the system, including a policy level. So it's how is it that a state can institutionalize good policy practice feedback loops. I've worked in several states where we've been able to do this work and be able to get, at least on a quarterly basis, practitioner level experiences set up to leadership teams that feel accountable at a state administrative level to get back to counties and practice levels to provide feedback and recommendations and things that they're doing to make those system level changes that are necessary to facilitate good implementation. So it can be done, and it's something that I've seen done well and is very important for sustainable implementation. So in summary, it's really about the purposeful selection of an effective and feasible home visiting model. You want to conceptualize a change process where you're using stage-based activities to guide the process. You're focused on those drivers to build your infrastructure. Your work is never done, and you're always looking at those improvement processes, and you really invest in that development of organized expert support. Thank you.
Thank you so much, Allison. That was great. And as I was listening, I really felt and saw a lot of the aspects of the MCV program, knowing what states were doing around some of those driver areas. And I also thought it was interesting in the stages of implementation where states are probably feeling, possibly with different sites, they're in different stages. And so the complexity of what they're having to attend to is really something. Now we're going to move on to our final presenter, Laura Lewison from North Carolina.
Thanks, Maria. Hi, everyone. My name is Laura. I am going to talk about North Carolina's efforts over the past year to use the frameworks that Allison just talked about to structure our MCV implementation and our home visiting activities operating out of the State Division of Public Health. And I want to say that I really appreciated Nancy talking a little bit about how they felt like they kept coming back to the implementation synthesis and coming back to the document and felt a little bit like they were sort of bumbling around before having that guiding framework. That's true for us as well. I think we have been very lucky over the past year, and I really want to thank Alice. We worked very closely with some of Allison's colleagues at NERN, and that has been incredibly helpful for us in providing a structure for us to think about implementation within. But that doesn't mean that we've got it down even close to perfect yet, and this is very much still a work in progress for us. Very briefly, home visiting North Carolina pre-MCV, I think, looks very similar to what what Nancy described in Washington State. We had a network of home visiting models across our state with varying funders, expectations, infrastructure, scaffolding, varying levels of model fidelity. And North Carolina, similar to Washington, made a commitment on the part of the public and private funders to think about using funds collectively to support effective implementation of evidence-based models. And that included not just funding the models themselves, but also funding some of what we call the scaffolding or the infrastructure to support them. So that was true for our funding of Nurse Family Partnership in North Carolina prior to MCV, and really laid the groundwork for us as we moved into the McV era and the tornado, in thinking about what we saw as being necessary or important to really be able to support evidence-based practices in the field. So like all the states, North Carolina was very excited by the federal funds that were made available through the Affordable Care Act for home visiting, and like all the states, we had to move very quickly to create our state plan in response to the STR and move forward. And so I'm going to talk a little bit about our implementation of the McV funds around the implementation stages that Allison laid out just now, and thinking through sort of what our implementation has looked like at varying points. And I'm going to talk about it from both the state level, so what we've done at the state in order to support implementation and with respect to the frameworks, and then also at the local level, because we've come to see that they are truly a parallel process and inextricably linked. So it isn't enough for us to support good implementation of evidence-based practice at the local level. We have to sort of practice what we preach at the state level and be a facilitative administration ourselves. And that has had its challenges, I think, which is not a unique situation for North Carolina. So starting with sort of the exploration and sustainability phase, because of the tight timeline with which you're all very familiar for this STR, we didn't have as much time to spend in this phase as we might have liked. But we did our best to work at both the state and local levels in doing some exploration work around thinking about fit between need and models, so ensuring that we were selecting evidence-based home visiting models that really met the needs of our state and, more importantly, of specific communities within our state. At the state level, this looks like having conversations with our stakeholders around where home visiting fit within our state's comprehensive early childhood system. And so one of the things that our work with NERN has really illuminated for us is the fact that we can do grants management or we can do program implementation. And grants management is often our default strategy, where we sort of check boxes and ensure that we keep and maintain our funding stream and do our best to monitor what the activities are in that grant. Whereas program implementation is thinking about the broader scope of our work and how that fits into a larger system. And so as part of our creation of the state plan, we really tried to have some of those conversations and think through where home visiting fit in a continuum. At the local level, we tried to support that same work happening in communities. So we, I think like many other states, did an RSA process for our McV grantees. And so we had a two-stage RSA process that we worked very closely with our NERN consultants on to have it, and it was unusual for us. It was different than how we typically do RSAs. We did a first round of the RFA that was a paper application where folks submitted budgets and submitted proposals, and we worked with NERN to embed questions in those applications that were related to the capacity and readiness of applicants to successfully implement or expand their home visiting programs. So those questions got at some of the organizational drivers that you saw, some of the implementation drivers that Allison talked about. They talked about community and stakeholder support. They talked about folks' experience implementing evidence-based practices, and that was very helpful for us in our selection. We had folks who had done a lot of implementing EBPs, and we had folks who could only identify WIC as an evidence-based practice, that they had a history of successful implementation. And while WIC is wonderful, it's not quite the same thing as what we're talking about here. We then did a second round of our RFA process with our top candidates, and we did site visits, local site visits, where we not only did our typical, maybe what we might do in a monitoring site visit, where we met with agency staff and administrators, but we also did a part two of each site visit where we met with community stakeholders and groups to have a sense of what community buy-in looked like, what this home visiting program, how it would be integrated into the larger community. And we ended up with funding 7 sites. We funded 4 Nurse Family Partnership sites, 3 Healthy Families America sites, and we have a really nice mix of rural and urban sites, as well as brand new startup sites and expanding sites that successful implementation prior to McLeod. So it's a very nice group of folks with diverse experiences, and obviously these programs operate in collaboration with many other home visiting programs in our state. So I'm going to talk about our next phase, which is the installation phase. And this is the phase, as Allison talked about, where you have an opportunity to almost pause between selecting your model and implementing it, and make sure that you have all the resources aligned that you need to support implementation, and that you have created implementation teams. I'm going to talk about this, how this played out both at the state and the local level. And in this, these pictures you see on the left is Oz, the Emerald City. You can kind of imagine that as state government, although we're not quite so sparkly. And on the right is Munchkinland, and you can think about that as the local folk. In thinking about our installation phase at the state level, we have faced a number of challenges. And in some ways, we ended up moving into implementation with our sites, funding our sites, and moving forward and supporting them without ever having really completed what we would have liked to during our installation phase. And we operate within a bureaucracy in the Division of Public Health that was probably very familiar to many of you. And that bureaucracy is not always as flexible and responsive as we want it to be. I really appreciated Allison talking about struggle with systems change and how we need change to come from our innovations up, and often it comes in the other direction. And so we have faced roadblocks in our effort to really implement the frameworks, the best practices that we know about implementation at the state level. And they've been roadblocks in terms of HR and having a full implementation team, being able to hire the folks we need, and contracting and those pieces. And so this has been an ongoing challenge for us. And you see our picture of the, I think it's the gatekeeper, the MCC up in the right corner, and that's because we've got lots of gatekeepers in state government that we work with. And so this is an ongoing process for us in an effort to figure out how the Division of Public Health, how a state agency can really truly be a facilitative administration that supports effective practice at the local level and can be responsive in that policy to practice feedback loop. So we continue to work on this. I'm going to talk a little bit more about how we've supported our sites at the local level in moving through their installation phase and into implementation, because all of our sites are currently implementing and serving families, or are about to serve families imminently in the next week or so. We did some work with sites prior to initiating our contract, so during the implementation phase, and we did a number of things during those site visits to prepare sites for what we kept describing as, this isn't business as usual. We're not just going to do your monitoring and go away, but we really are going to be what Nancy talked about in the beginning, about an ongoing, constant, supportive presence for sites, and at least we hope they perceive it that way. So we have done work with sites in those site visits around establishing mutual expectations in terms of reference, and developing and sort of putting into policy communication mechanisms to ensure we have a policy to practice loop with our sites. And we've actually seen that play out really nicely as our sites engage with challenges around referrals and care management in our state. And with the support of the National Implementation Research Network, we've also focused on training and on creating mechanisms for folks to share lessons learned throughout the installation phase around selection of staff, and around data system building, and around putting policies and practices into place that can support ongoing QI processes. So we've done that through one-on-one TA. We've done that, we did a webinar with our folks very similar to what you saw today around implementation, so that everyone had a common language, and we've done a lot of work to create a common language around implementation. We've done a lot of focused work with sites on sharing lessons learned as they got their programs ready to go in the installation phase, particularly around selection and hiring and behavioral rehearsals, and that was very interesting for staff, and people felt like that was very beneficial. One of the challenges we've had, and this is where we're going to get some feedback from you all, is one of the challenges we've had has been in making this information relevant and interesting to frontline staff. And so we made a commitment from the beginning that we wanted this not just to be information that we were disseminating to administrators and supervisors, but that we wanted to get home visitors engaged as well. And so we have had challenges in engaging some of our home visitors in this implementation science and in making it interesting to them. So in just a second, you will see a screen appear with a question, and we'd like you to mark your answer to the following questions. And the question is implementation science relevant to home visitors? So thinking about frontline staff who actually do the work in the home. Your options are yes, no, or not sure. And if you select yes, please let us know in the public chat box on the bottom left-hand side of your screen how you think home visitors can use this information to inform their practice, or how you perhaps have done some work in making this salient, relevant information for home visitors. And we'll pause for the results to come up. It seems like the majority of folks think that yes, it is relevant. And that is certainly what we think as well. I'd be curious if you have any thoughts or feedback, please share them in the chat. I can tell you that one of the things that has resonated with home visitors is learning some of the QI tools, in particular the PDSA cycle. We did some training with home visitors at a 2-day grantee meeting around practicing the PDSA cycle and put in place some accountability mechanisms for them so that we would check in with them to see about where they were in their PDSA cycle. So that information in particular, having something concrete and actionable, that felt good to home visitors. I'm also just going to talk very briefly about, and I see that we had a comment in the public chat that talks about home visitors feeling included in so that they can feel ownership and understand what they're doing, and that's completely the perspective that we approach this from. We wanted I think this information can be very empowering for home visiting staff because it can place their work in context. I think often we think about success or failure of interventions as happening sort of discreetly at the individual level. So why couldn't this home visitor make this work? Or how come this relationship was a failure? When often there are, I think what we see in implementation science is there are so many reasons that things are perhaps not able to be successful that are outside the scope of an individual's practice. So I agree. I think this information is really relevant and interesting for home visitors, but it is a challenge for us to make it not feel overwhelming, particularly as folks are coming on and being trained. And it's also important for us to make it feel connected to their work. One of our challenges has been working with a 4-county rural implementation project that's one of our MCV grantees, where there is a history of healthcare professional shortages and also a history of collaboration on public health projects, but perhaps not as much experience implementing evidence-based projects and not as much experience working with a program that requires model fidelity. So this is a site we've done a lot of very focused TA with the 4 counties, and so we've brought people together with a host organization who is the actual recipient of our funding to do the same kind of work that at the state level we're doing with our sites. We're having these 4 counties do together. So and that's establishing terms of reference and communication goals, and establishing an implementation team at the local level that doesn't just include folks from the grantee organization, but includes folks from all 4 counties. So everyone who's on the implementation team represents a stakeholder group. And that's really important for us because this is not a project that could just be isolated in this host organization. I think this is these 4 counties, I think at last count, had close to 20 possible referral partners that were just providing prenatal care. So we needed to have really comprehensive buy-in from those folks in order to make this work. And so this has been an ongoing learning experience for us about how to support a group like this with so many different stakeholders, so many different partners, how to support them in effective implementation and linking them to each other. So Maria, I'm going to turn it back over to you, I think.
Yes. Thank you, Laura. That was another great presentation, and I think had a lot of relevant information as well as some concrete ideas for folks around getting started and working with sites. So at this time, we're going to move into the question and answer portion of our time together. And we have received a few questions. If you have additional questions, please type it into the chat box in the bottom left-hand corner. And we're going to take questions in the order they've been received. So the first question that I received is asking the presenters if they could, if they had ideas about how to help policymakers and funders understand the importance of funding this kind of work. And also, if there were any ideas about, you know, why the models are not paying for this specifically. That wasn't directed to anyone in specific.
I think Nancy or Laura might be a better person to answer the question, but this is Allison. I'll just chime in really quickly, which is, I think in terms of getting, you know, policymakers to understand how important this kind of work is, I think a lot of it does have to do with data and with what current outcomes look like. And there's just a lot of information around the gap between getting evidence into practice and maintaining fidelity and getting good outcomes, and there's cost issues associated with that. So there can be some really compelling kind of research and you know, economic evidence as to why implementation science you know, can be so important. And what was the second part of the question, Maria?
The second part.
The program developer piece. I mean, we have this kind of mantra at NERN, which is that not all purveyors are created equal, which is the idea that you know, purveyors and program developers do offer very different things, and some do just provide training. And so for us, they would not fall in the category of a purveyor if that's all they provide. A lot of the purveyors for evidence-based models provide much more than that. They do provide fidelity and monitoring and support around data systems and you know, support around thinking through systems barriers and other things like that. A lot of them are in the form of learning collaboratives that provide that. So one of the things that we talk about is being a very good consumer of the evidence and consumer of program developers. And so kind of going back to the triangle and the infrastructure pieces, you know, many times when we're kind of interviewing purveyors, you know, we're kind of moving up and down that triangle to have a sense of what do they help us install beyond just, you know, the initial training. And if they can't help us install certain things, we have to then look internally and see whether we would have the capacity to implement that ourselves or to develop the things that we would need to develop. So, but a lot of good purveyors do provide anticipatory guidance related to the right side of the triangle and kind of go beyond just the competency piece. But again, I'll let Laura and Nancy talk from their perspective.
This is Laura. I think one of the challenges we've had is where we work with purveyors who don't offer that we have wrestled as a state with what it means for us then to develop that system for ourselves, whether that's sort of worth the resources and time that it takes to develop that kind of infrastructure and scaffolding or not. And I don't know that we've reached an answer on that. And I think we've seen it be more or less successful depending on models.
This is Nancy. I want to just echo what you were just saying. I think that in Washington, I think that that's the question we're struggling with now in terms of just our funders too, is trying to explain if a community is interested in implementing a certain model and there isn't the support embedded in the model, that the investment has to come from the state in order to move that model along. And we are doing some very preliminary work right now with some of the national models to address some of these concerns. It's a really good question, though.
Thank you all. I'm going to go to the next question, which I think may have partially been answered. It came in during the presentation. And the question is, does systems intervention include advocating for policy and procedure change at the state level, or is this only looking at the organizational level? And that came in before that policy practice feedback loop slide, but I think, I know, Allison, you had a few things to say about that, but I don't know if you wanted to maybe give a concrete example of how that is working, and also Laura and Nancy could maybe speak to how that might look in their states.
Yes, so the answer is yes. For the systems intervention, it does include advocating at the policy level. Many times the things that fall kind of more at an organizational or management level, I kind of put into the facilitative administration driver. So I would think of that kind of advocacy work as really falling into the systems driver. And for sure, a lot of that has to do, with work that I've done, advocating with your state legislature and, getting things put into statute that need to be, or getting things codified and extra funding for that. And so those are the kinds of things that sometimes are your longer term strategies. Many times the quick wins associated at the systems level have to do with simply getting buy-in for kind of certain activities, or kind of getting key partnerships on board, and some of the actual changes that might need to be made with the state legislature, or that kind of advocacy work is sometimes the things that take a bit longer. But for sure, one of the things I like to do with all the drivers is to identify the quick wins and the things that will take a little bit longer, because when you put an infrastructure in place, just want to add this little piece. One of the things that I've learned over the years is getting at least 1 or 2 quick wins for every driver is so critical for momentum.
Great. I'm looking at the clock here, and we only have about 2 minutes left. And in the respect for everyone's time, I think we're going to move towards a wrap-up. We did have a couple other questions that came in that are great, and I want you all to know that the implementation science framework conversation will continue in a variety of ways. So your questions that you sent in won't be lost, and we look forward to having more discussion about this in the future through our Technical Assistance Coordinating Center. But right now, I want to say thank you so much to all of our presenters and to all of you for joining us. And before I send you off on your own journeys toward the Emerald City, the Wizard, and all the answers to your home visiting questions, we do have one very important request. You will be receiving a feedback form from Africa Queen within the next 24 hours. And I know that all of you realize how important data collection is. So we would truly appreciate you taking a few minutes to complete the form and give us feedback regarding your experience during the webinar today. And I'm looking at the clock, and it looks like we're just 1 minute to go. So thank you all again for joining us, and we look forward to sharing more discussion on our upcoming webinars. Bye for now.